We're live.
Welcome to the 12th COVID313 Community Coalition for Families and Students Teletown Hall. Hi again, I'm Christine Bell, mother of 3 amazing children, honored to serve as the Executive Director of Urban Neighborhood Initiatives, a proud member of COVID313 Community Coalition for Families and Students, and co-moderator for today's Town Hall. We have an exciting group of speakers today that will help us to better understand the strategies behind the slogans. We will also hear from DPSCD and a charter school representative on the plans for reopening schools for the fall. We're going to get started in a few minutes. We're translating the town hall to Spanish, Arabic, and ASL. So we want to give folks time to get in the right line and to get comfortable. Cindy, please share the phone number for Spanish translation.
Si necesitas traducción en español, por favor habla al 313-626-7440, 313-626-7440.
Thank you, Cindy. Saeed, please share the phone number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030. الرقم again 313-241-7030. Thank you.
Thank you, Saeed. Katie, please share the instructions for ASL. Thank you, Katie. We want to hear from you today. Please chat your comments or questions on Facebook or text them to 313-288-2082. Again, the number is 313-288-2082. To get us started today, please welcome Nkenge Browner. Nkenge?
Hi everyone, I'm Nkenge Browner. I'm the organizing director at Mother and Justice. Today we're going to discuss a subject that seems new but actually isn't. Parents are split when it comes to defunding the police in our schools. I've heard so many different opinions about this, and I wondered why this was the first time I've heard so much conversation about defunding a school program. Hadn't we allowed so many programs to be defunded? Right now, 54% of our schools are underfunded. This percentage is higher in inner city schools, of course. There are so many programs that were defunded without a fight or even a healthy debate from parents. Why weren't we more vocal when multiple elementary schools lost after-school programming? They doubled as childcare for parents and for working parents and offer kids internet access and meals so they were able to do homework. These programs help to close the class divide and allow students who may not have had the support needed at home to compete academically. After-school programs were defunded. Many of our middle schools have lost counselors or split them between schools, so students have limited access to mental health services. Counselors were defunded. 14 DPS schools need roofing and other repairs. However, the funding isn't available. Maintenance was defunded. Of 81 schools, 55 have no art programs. Art was defunded. Of 81 schools, 51 have no instrument or vocal teachers. These programs were defunded. And sadly, many students who require special needs services aren't getting their needs met simply because we allow special needs services to be defunded. Our students need these services. The call to defund the police in our school is a call to reallocate the funds and to refocus on mental health services, free lunch programs, art and instrument classes. To focus on teaching and developing students, to end the prison to pipeline epidemic for Black and Brown students, and to fund programming that tells our kids our investment and responsibility is to them. Please stay tuned for more information and an opportunity to ask questions. Thank you. Arlissa?
Thank you, Nkenge. That was powerful. Again, my name is Arlisa Hurd. I'm a mother of 2 sons. I'm a first-time grandmother, member of 482 Forward, and also member of this wonderful COVID313 coalition. And I reside in the Hope Village community. You know, as we think about timelines and what has occurred, I don't know about you, but these last 12 weeks have felt like more like 12 years. They have been life-changing, painful, devastating, and even tragic. Now, we cannot and should not minimize or deny any of that, but we have to admit that there seems to be something beautiful that is arising out of the ashes. I mean, just think about what we are witnessing in this moment. For years, we heard from the people about minimum wage and service industry workers, how they were not being respected and denied the opportunity to make a decent living wage. And now, those same workers have become critical, essential to our survival, and suddenly earning a decent living wage is no longer unthinkable. For years, we heard from people about overcrowded classrooms, how we needed to consider different ways for kids to learn, how a lack of technology and internet access impacted students and their families. And now we have to reduce classroom sizes. We have to explore different learning options for students, and we must provide technology and internet access. For years, we heard the people about police brutality and the mistreatment and murders of Black and Brown people. And now we have cities and states reimagining safety, discussions about defunding and repealing age-old policies that consistently kept law enforcement, disciplinary records secret, and kept bad cops covered and on the payroll. For years, we heard the people about how Black lives mattered and how silent protests like taking a knee was not about dishonor, but about respect. And now we see other countries honoring and standing with us. We see people protesting in the streets like never before. We are seeing whole corporations and sports organizations acknowledging the significance of Black life, and they are turning away from traditions and practices that routinely dishonored and disrespected our ancestry. Confederate flags and public displays are coming down and being removed from institutions, and that's huge. Yes, I believe lots of beautiful things are happening and still coming, but I want to encourage us that we still need to stay the course and don't let up. This is not the time to get relaxed. We have to continue to push. We have to continue to fight. We have to continue to stand. We have to push to stay healthy and not slack on guidelines simply because things are opening up. We have to fight for the justice that we all deserve, and we have to stand on faith and on principle and don't be moved. My father always said that victory costs you something. And right now, victory is definitely on the horizon because we have certainly paid the price. Now we're going to hear from Cindy Gamboa. Cindy?
No sé. Thank you, Arlisa, for those powerful words and helping us set the context. Hi, everyone. I'm Cindy Gamboa. I am glad to be back here with you guys today. So the question right now in the moment is, how do we show up right now for our Black siblings as allies? What is our role right now? Dismantling white supremacy is our job. We built these systems and continue to benefit from them. We've been propping them up, so it's time that we start to tear them down. Together, we need to say enough. That means you have a role in this movement, a role in combating racism. Remember, we're being called to action right now. Our Black siblings are asking us to do the following things. Listen and follow Black leaders. It's not enough simply to be not racist. We have to push ourselves to actively be anti-racist, which takes lots of work and creates tension, but which will ultimately be liberating for ourselves and for our Black siblings. The system of racism is not just overt racism. we often point to, like the Klan, it's in our systems built in our country. The police, our schools, our courts, our homes, our workplaces, everywhere. It's in the foundations of how our systems function. It's how it shows up in our individual interactions and in our systems. That's called white supremacy. And it's on us to tear it down everywhere we see it, from the White House to inside of ourselves. We must interrupt racism in your families, in our communities. Do not let relatives say racist things, and invite more folks to join the movement. That means we have to interrupt racism everywhere we see it, in ourselves, in our families, in our workplaces, in our own communities. This also means widening and building our base of white people and colored people of color that are in the movement. We need to call our folks into the movement, in our families, faith communities, neighborhoods, workplaces. And lastly, we must make a commitment for the long haul. That is not something that we have to just jump into the movement and jump out. We need to fight racism for a lifetime. This means being uncomfortable, taking risks, changing as individuals, and means listening deeply to our Black and Brown community members. Last week, our Black COVID313 siblings have asked us to tell you to write 3 things that you've been taught about Black people that you know now that are wrong. Now, did you do that? If not, you can still do it. Do it now. Then I want you to make a commitment to talk to 2 people you know and challenge their racism and narrative that you know are wrong, and invite them to join you in being anti-racist. It's gonna take all of us to dismantle the system of racism, but it's on us to fight anti-Blackness together, because co-liberation is gonna take us all. Thank you. I'll pass it over to Christine.
Thank you, Cindy, for reminding us that we must do our work to dismantle white supremacy so that we are better allies to the Black community. As our Lisa so beautifully stated, these months have been full of struggle and heartbreak, but there have been victories. Yesterday, we were victorious as the 6th District Court decided not to hear the right to literacy lawsuit again. This means that our children have the right to be literate, and our lawmakers have a responsibility to ensure our schools have the resources they need to teach our children. This win is an example of how powerful we can be and the change we can make when a diverse group of people that share the same values come together, that we can accomplish and fight together, and we can win. We're gonna, one more time, give people an opportunity to get to the right place for translation. So Cindy, can you please share the number for translation, Spanish translation once more? Well, we'll wait for Cindy to be able to get on. Saeed, will you share the number for Arabic translation?
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030. الرقم مجددا هو 313-241-7030. وشكرا. Thank you.
Thank you, Saeed. Cindy, are you able to come off mute and share the number for Spanish translation?
I will jump in.
Thank you, Christina.
Yes, if you need Spanish translation, please call 313-626-7440. Si necesita traducción en español, por favor hable al 313-626-7440. Hoy está la señora Gloria Rosas y Cristina Ruiz traduciendo. Gracias.
Thank you, Christina. Katie, please share the instructions for ASL for folks that have just arrived.
Thank you, Katie. And everyone, welcome to now, I believe, our 12th COVID-313 Town Hall. My name is Jametta Lilly, and I'm one of those women from Michigan. I'm also blessed to be the CEO of the Detroit Parent Network, where we educate, equip, and empower parents as champions for their children and for change. And I want to lift up that word change, because that is the word of this extraordinary moment in this part of our history. As the speakers before me have said, we are witnesses to something profound. And out of the ashes of COVID, and we're not out of COVID yet, we're still seeing powerful victories. And those victories are the result of our knowledge, of our perseverance, of building internal as well as external coalitions to have effective change. And effective change now, people understand the root of racism runs deep in this country. The root of health and educational disparities and economic disparities run deep. And we must be in it for the long run. That is the only way that we will win, and we will win. So I want you to know also about the COVID Coalition. For those of you who may not know who we are over 30 different organizations, faith-based, foundations, school districts who've come together every week to say that facts, resources, and support matter. And we are here to continually be a resource for you. We're delighted, and we are change agents at the moment and for the long run. So right now, I want to make sure that you get comfortable. So for the next 90 minutes, we're going to keep you informed, connected, and powerful. This is also a time for you to have a dialogue with our experts. We have it so that you can go to your Facebook and type into the chat any questions. You may also text us at 313-288-2082. Again, you can text us at 313-288-2082. Put in your questions, and we will have a significant time after each one to facilitate that. All the questions asked today will be posted with answers on onedetroit.org. Cindy, please share the Spanish translation number for our folks, just those who have just arrived.
Para traducción en español, por favor, comuníquese al 313-626-7440. Muchísimas gracias.
And thank you. For our experts, please remember to speak slowly for our translators. That way we want to make sure that they are translating this important information correctly. Also, those of us who are on this Zoom call, please make sure that you're muted and that your camera is off until your time. Terry Whitfield, who is central to our back office for this production, will chat you very nicely about your time. And if you start to run over, I will try to gently let you know that we need to move forward. So again, we're delighted to have you, and we'll get ready to move into our main program. I just want to repeat again, if you have questions, make sure that you can put them into the Facebook Live, or you can chat them to 313-288-2082. So we've been talking about racism, and now the nation has a better understanding of that. But not just this nation, we understand that racism is a disease that has impacted the world. And it's important to understand that the nature of racism not only is in institutions, but it's in our minds, it's in fact in our very psyche. So really, it's probably a public health and critical need for us to address. And to help us have a better understanding of racism as a public health issue, we're so pleased to have Enrique Nesbitt from the University of Michigan School of Public Health to talk to us precisely about this issue. Enrique, welcome.
Good morning, everyone, and thank you, Jeanette, for that invitation and introduction. I'm really happy to be here. I want to start out by thanking Angie Reyes for the invitation to join you all this afternoon. I am a professor in the School of Public Health at the University of Michigan, and I'm also the Associate Director of the Detroit Community Academic Urban Research Center. So as a number of folks have mentioned already at the beginning of our call today, we have seen a number of headlines highlighting the importance of racism as it relates to coronavirus, and now in recent weeks in the context of police brutality. On the screen in front of you, you see a number of headlines that highlight how hard and the impact of racism on our communities. Blacks hit harder by coronavirus. Coronavirus response must confront poverty and racism. Police brutality must stop, medical group says, so on and so forth. At the heart of all of these headlines is the idea that racism is a public health crisis. Next slide, please. We know that racism is something that affects our entire community. So my work focuses on African-American young people, but this is not an issue that's specific to African-Americans. There's been a lot of attention, particularly with COVID, around American Indian populations, Latino populations, and other communities of color. Racism affects health profoundly in a number of ways. So mental health, depressive symptoms, anxiety, perceived stress, it affects blood pressure. All of these things have been well established in the scientific literature. In the last year, we've started to see a number of local and state governments and professional and medical associations who said enough is enough. We've got to recognize racism as a crisis, as a public health crisis. This began last year with Milwaukee, Wisconsin, and has recently, most recently been in the news around Ohio, and a number of folks that are introducing legislation to recognize racism as a public health crisis. Specific measures have been suggested, such as reviewing ordinances and how they promote inequity. Others have suggested that it's important to look at workforce development. Others have said we've got to just name it and even define racism. There are a number of specific action steps that we have to take. Next slide, please. Most of us on this call use the term racism and we have an idea of what we're talking about. The important point I want to emphasize is that it's a system. It's not just individual, interpersonal verbal assaults, for example, but it's a system of structuring opportunity and assigning value based on the social interpretation of how a person looks. It unfairly disadvantages some individuals and communities, and it advantages others. Mostly in the United States, you've heard people interchangeably call it white supremacy, and that's because whites are often the group that is unfairly advantaged. People pay a lot of attention to individual racism, or what we call racial discrimination, but really at the heart of a lot of the things we've been talking about in the last couple months are institutional racism. Institutional practices that impact the access and the rights of particular groups. Doesn't have to be intentional, it can be unintentional, and some examples of this are immigration policy, incarceration, the justice system, so on and so forth. One type of racism that doesn't get a lot of attention, but that's really important in thinking about youth and all of us really, is cultural racism. Racism is ingrained in symbols and ideas, the language that we use, negative depictions of Black and brown people on television get into our psyche, into our mind, and affect the way that we view ourselves, affect our efficacy, our competence, and how positively we feel. So as we think about racism, it's important that we not only pay attention to individual, but also the structural, the part that acknowledges racism is a part of the fabric of our society. Next slide, please. Here on this list, you see a number of explanations that people have given to understand why there are racial disparities in COVID-19. At the root of many of these, however, is systemic and structural racism. People have talked about chronic underlying conditions, but we have to stop and ask, what are the reasons that these disparities and underlying conditions exist? They have to do with access to quality healthcare, access to health insurance. They have to do with the environment that individuals have access to in their communities. People have talked about occupational vulnerability. Why is it that African Americans, Latinx communities are disproportionately represented in essential workers? We've got to think about some of the limits and access to quality education that has been an issue for our communities. People have talked about testing disparities. Well, why do those testing disparities exist? It's because there's a valuing of certain communities over others. And so some communities have quick access and are able to get quick results while others are not. People have talked about poverty, financial insecurity, housing insecurity, standard housing or substandard housing. There are laws and practices that have been codified going back to Jim Crow segregation and even before that, that have put these economic practices into law and made it a part of the fabric of our society. So it's not just about poverty, it's about these laws and practices that are not only historical, but that continue even today. When we think about the protections for essential service workers in the CARES Act, for example, those protections are not accessible to all. In fact, some of the people who most need those benefits are ineligible for them. There's a host of other explanations that have been given. Medical mistrust, people thinking their care providers may not take them seriously, not having access to information. People may not have access to the internet, for example, and there are practices that if you are unable to pay your bill, you may be put on a list and unable to get off of that list. These are things that have implications for who has access to important information that we need to be able to stem COVID. Prison vulnerability is another topic that has been raised. We know that Black and Brown people are disproportionately affected by the justice system and in prisons. And the inability to practice some of the social distancing hygienes in crowded spaces is a factor. Others have said that in addition to the COVID pandemic, we've got to talk about the stress pandemic, that African Americans are dealing with loss, and that the effect of loss, the effect of economic instability has an effect on your mind. At the root of all of these, again, are structural racism and systemic factors. Next slide, please. In recent weeks, we've seen a lot of attention to police violence. Getting killed by police is a leading cause of death for young Black men, and we know that there are other communities that are also affected. Latino men, for example, American Indian men and women are affected. We know that it's not only shooting deaths and the murdering of folks that has impacted us, but that even just watching the looped footage and being aware of the law enforcement deaths has been associated with adverse mental health among Black American adults and others. I've been getting a lot of questions in the last couple days about how we balance protesting against the racism pandemic and the coronavirus pandemic, and how, which one should we pick? And the point I've made to a number of reporters is that for some people, this is not a choice. Folks are willing to put their lives on the line to risk contracting COVID because they are fighting for their humanity. And so it's really important that for many of us, this is not an either or, but a both and. We've got to do both of these, and we've got to ask the critical question, Why do folks feel that they have to put their lives on the line to fight for their personhood? Next slide. In conclusion, I just want to say a couple of quick things. We know that this is a systemic problem, and systemic violence requires a systemic response. I hope that we will see more lawmakers taking on public health as a crisis that must be addressed, taking on racism as a public health crisis. We must prioritize the health of people of color and support initiatives at all levels to dismantle systemic racism and white supremacy. And then finally, it's important that we recognize words are not enough to repair the damage of centuries-long racism. As has been noted previously, these are patterns for hundreds of years, and making statements or talking about it for a week or two are not going to address the long-standing damage. Thank you very much.
Enrique, and thank you. That was indeed a very profound and short and pointed presentation. And we hope that people have fully understood the depth and breadth of which racism exists into the very fabric of our society. And also thank you so much for putting this in a holistic way, the way that public health generally does, which is one of the critical values for our health community to know, that public health has that holistic community view. So we're going to transition in our program, and I'm so delighted, as well as everyone else with the COVID313 Coalition, to invite our next guest to speak. And that next guest is a dad, a husband, a tech guru, an organizer, and really important to all of us here, he's a Detroiter. And who am I speaking about? I am speaking about our Lieutenant Governor, who is Garlin Gilchrist. LJ, as people call you, you are welcome to the COVID313 Coalition. We'd love to hear your thoughts about what this moment looks like in America, in Michigan, and then have some discussion about the task force for the Coronavirus Racial Disparities Task Force, which I am blessed to be a part of. Lieutenant Governor.
Thank you so much for having me, and thank you for your willingness to be part of this task force that is looking to deal with the disparities we see in infection and mortality rate for COVID-19, both in the short term, but also to connect that to longer term work to addressing racial disparities when it comes to health outcomes, and frankly, the social determinants of health that contribute to those health outcomes. So I appreciate that. And I want to thank everybody for allowing me to be here. This is an important coalition made up of a number of organizations that I am already friends with or have a relationship with or have been able to work with in the past. And I thank you for the leadership and the example that you show and set as we all work toward what I believe is the common purpose of equitable communities and a society that just recognizes our basic humanity, and with that humanity, the right that we have to the opportunity to be our best selves and to have a chance of success and to pursue our own happiness. That's really what we're asking for. Every cry for justice that has happened in our nation, certainly, every cry for justice is a cry for equity. It's a cry for investment. It is a cry for resources that have been shut out or have been denied from groups of people and communities. I mean, every time we're shouting for justice, Black people, this is part of what we're shouting for. And even when we're thinking about this moment, as we have seen yet another illustration or instance of police violence and brutality that has killed another Black person, whether it's George Taylor, whether it's Ahmaud Arbery and a lack of response to that, whether it's Breonna Taylor with her life being taken from her in her sleep by law enforcement. You know, this instance has triggered, for me at least, just speaking personally, this reaction of yet again, of thinking about all the times when I have been in contact with law enforcement, have been discriminated against. Remember the first time I got pulled over when I was driving to high school in the morning for going 24 to 25. Thinking about all of the times when I have been in situations where I could have been George Floyd, where I've seen my friends brutalized or potentially brutalized and tried to intervene All of these situations sort of, they get brought up for me every time we confront this publicly. But I think this moment is unique for a number of reasons, and we have an opportunity, and I think frankly an obligation and responsibility to take advantage of it. Because at the time when we have been dealing with the COVID-19 pandemic, this pandemic that has disproportionately killed Black people, disproportionately killed and infected communities of color across our state, and a phenomenon that has been observed across the country, we have a responsibility to do things now and to do things that can impact us in the long term. So when it comes to policing, our administration, Governor Gretchen Whitmer and myself, we announced an initial set of reforms last Wednesday in response to how we can not only improve policing, but how we can improve the culture and the community that we need to build. And I think part of that starts with just frankly needing to state or to make it clear that everybody does not experience feeling like law enforcement is on their side, or that law enforcement is on the same team, or that law enforcement is rooting for their success. And the violence that we have observed is a manifestation of that experience, and we need to change that. And so that involves changing policing practices, which is what we put forward in terms, and recognizing that changing those practices starts with how we recruit and how we train law enforcement, and recognizing that in order to lay a baseline or set a pretext for accountability, we need to set a baseline for what we expect. And so the training investments that we chose to put forward, whether that's in implicit bias training to help with relationship building, de-escalation training as a requirement, reinforcing the duty to intervene. All of these things are down payments on changing those relationships. We also have supported legislation in the Michigan Senate that is reforming our Michigan Commission on Law Enforcement Standards, which is the body that sets the baseline for how law enforcement conducts itself, how licensure and accreditation and training and accountability works for law enforcement in Michigan. Adding some teeth to that, something that we've supported and will continue to support and continue to act on, including adding more support and oversight. So we've taken some actions now, but we need and are exploring what more we can do. And I think this important question on equity and investment and resources is one that also is critical. Our administration, frankly, alongside and responding to the leadership shown by many of the groups who are part of this coalition, has made significant changes to the investment priorities in the state of Michigan. We introduced and put forward and passed the most equitable education budget when it comes to education funding that's been put forward in a generation since we changed how education was funded in the state of Michigan 26 years ago in the mid-90s. And we're building upon that, or chose to try to build upon that in the budget we put forward this year before COVID-19, frankly, altered our budget reality here in the state of Michigan in a way that we're still trying to wrap our arms around so we can deal with. But I ask you to actually think about where were you most safe in your life? When did you feel most safe? What was that experience like? And I think that came when you were invested in, when you were nurtured, when you knew that you were cared for, when you knew that you were supported. And that is the experience that we need to create for everybody in Michigan. That is how we create the conditions for Black people in Detroit, and for communities across our state, for Black folks that live in our urban centers, for Latino people that live in our urban centers or in our rural communities, for people who in our tribal nations. We need to make sure that everyone feels like they are supported and invested in, and they experience that, because that will lead to them having access to what they need to be successful. Access to education for themselves and their family, access to healthcare for their health and our community's collective well-being, access to opportunity, whether it's a job or an entrepreneurial opportunity, access to training and resources so you can grow and continue to be your best self. These are the things and the investments and the choices that we've put forward as an administration, that we've enacted as an administration, and that we will continue to invest in, because that is what creates safety, and that's what we're focused on. To talk a little bit more about the Michigan Coronavirus Task Force on Racial Disparities, which I chair, the goal of that task force, the intention, was to respond to the differentiated mortality rate in real time, and then to set us on a path to connect to longer-term health disparities work. This is not the first time that our administration has noted or addressed or responded to racially disparate outcomes when it comes to health, or when it comes to the challenges of persistent poverty that are present in too many communities and too many neighborhoods in the city of Detroit and across the state of Michigan. So what we've been doing and focusing on as a task force has been the sort of real-time work of testing accessibility, making testing more available to more people through expanding our testing protocol, dealing with the medical bias that was present early on when we didn't have enough testing capacity due to the failure of the federal government to provide a national strategy for testing, which led to medical professionals making choices about who got tested and who didn't, which led to discrimination because of medical and implicit and explicit racial bias. We named that. Dr. Jonae Caldoun, our chief medical executive, she sent a letter to every medical provider in the state of Michigan calling that out and saying that we need to be mindful of that. You know, following the research that shows that the way that you deal with that bias, one research-driven way to do that is to name it, so that you can be mindful of it as you govern yourself going forward. But really, we deal with that bias and that presence in those choice points when it came to testing by increasing our testing capacity and making it more accessible, which we've done by innovating the drive-through and drive-to models, where we are now taking testing to the most vulnerable people in our community, whether it's a hard-hit zip code, a nursing home, a homeless shelter, a jail, a prison, et cetera, to be able to make sure that people who are vulnerable can be tested. And all of those things, the more than 30 brick and mortar drive-through and drive-through test sites really established, have been due to the guidance of the task force. So the overwhelming majority of them, I think it's like 27 out of 30 of them, are in places where the majority of people who live are people of color. For example, that's led to, I think, 14 or 15 new testing sites in the city of Detroit proper, so testing can be more accessible to people, which is especially important as people join those frontline workers who've been working this whole time to re-engage in the economy, making sure that they can get tested, because testing is the front door to treatment. We also have been working to ensure that there's infrastructure and support for people who need to isolate, because it's very difficult for you to isolate if you live in a multi-generational house where there just are several people in your home, and you may have a small place, you may have one bedroom or one bathroom, that makes isolation impossible. So we're going to put in place the infrastructure to support that, making sure that as we changed our guidance to require people to wear face coverings and left their homes, asserting that they would not be discriminated against because they'd have the full protection of the Michigan Civil Rights Law, the Elliott Larson Civil Rights Act, to protect them. I was very concerned about that as a Black man, where if I go out in the wrong outfit, I already may have a certain set of problems. But certainly if I go out in the wrong outfit with my face covered, I could have even more problems. And so we wanted to make sure that we asserted that those civil rights protections would be present, and that we sent notice and guidance to every law enforcement agency in the state, with the Michigan Department of Civil Rights and the All-PAC Community Partnership Program, to make sure that there was specific guidance on how to govern themselves as law enforcement when people have their faces covered in public. One of the long-term pieces that we tried to deal with is the fact that too many people of color, too many Black folks, too many people who are fighting with poverty don't have health insurance, or have insufficient health insurance, don't have a primary care physician, or there's not a doctor that's located in your neighborhood or in your community or in a place that's convenient or accessible to you. But you may be coming into contact with a doctor for the first time, or the first time in a long time, in the context of this pandemic. And so members of the task force have created this very innovative sort of navigator program that can help connect people not only to primary care physicians, but also to other services that support people in their well-being. This is important because if you have a doctor and you have sufficient insurance, you can put in place a preventative health plan. You can better manage the chronic conditions that have been proven deadly when mixed with coronavirus, like diabetes and heart conditions and high blood pressure and asthma and COPD and all these other conditions that are difficult to manage if you don't have a doctor. And those have led to, and not having that doctor and insurance has led to some of the negative health outcomes before COVID-19. And we're trying to support changing that going forward. These disparities were not new with this pandemic, but the line was shown on them in a really bright way, in part because this pandemic kills so quickly. In these weeks since coronavirus came to our state in a confirmed way on March the 10th of this year, I've lost 22 people in my life. I bet every person on this call can point to people who they've lost directly or know people who have been directly impacted. This is real, and we need to respond to it. And this is connected to this question of police violence and brutality and how that has ravaged our communities for decades. I mean, I remember as a child, my dad went to high school with Malice Green. And I remember as a child, seeing and learning about that and seeing the response to that and having that conversation with my parents about, what it meant and why this happened, and getting that talk. And now as a parent myself, preparing myself mentally to have that talk with my children. I have 6-year-old twins and a baby girl who's 11 months, and thinking about why I would still need to have that talk with my own children. but it has been inspiring nonetheless to see the demonstrations happening in Detroit and to be able to show them and teach them what it means to demonstrate and why speaking up and lifting your voice matters, why using your power, why using the tools at your disposal matters, and why you can make change. Because the thing that I've been reminded during this pandemic is that, you know, the irony of all the social distancing is that our relationships matter, and their strength and their intensity and their value has been magnified. And also what's been magnified is the understanding, the collective understanding that individual actions can impact our collective well-being. So the act of speaking out, the act of standing tall, the act of making a phone call, the act of advocacy is important. And I believe in this moment, we need to channel that energy into making change and making sure that we're counted and making sure that we're at the ballot box in a record way and in a historic way, and making sure that we're advocating for the policy change that can happen at the local, state, and federal level. These are all things that we can do and that we must do in order to make this moment count. So thank you for having me, Jametta, and for pulling this together.
Thank you so much for your comments. And two things strike me, and then we're going to move to questions. One of the things that, as you shared, and certainly when we think about the phenomenal Dr. Joneigh Khaldun, is that your experiences have informed you in terms of creating policy and leadership. And that's one of the things that is so critical for us to make sure that we have representation in our government and in the citadels of power across the board, is to have people who've had this kind of authentic experience and are able to channel that for the good. I believe we have some, no, please go ahead and then we'll go for questions.
Yeah, I want to respond to that because it is right. I mean, you know, when you're talking about Dr. Khaldun, a Black woman, myself, a Black man, Gretchen Whitmer, the second woman to be the governor of our state, we have the most diverse leadership team in the country that is responding to the coronavirus. So therefore, it's not accidental that we have been mindful of racial equity and dealing with racial disparities in a way that no other state has. That we were a leader on even collecting demographic data that included race and ethnicity and reporting that out in terms of test results and deaths. Every state has not done that, but we made that choice early on because it's important. And yes, representation matters. You know, I learned as a community organizer before I, you know, came home and got involved in the public sector that you know, the people who have been most directly or who are currently most directly impacted by problems, they are the ones who are closest to the solution. Yeah. And so any table that does not include those people is not a table that is legitimate. And so we need to make sure that decision-making processes welcome and embrace people with direct experience, because that is how we ultimately get the right kind of change.
Yes, absolutely. And thank you for reminding those who don't know that Michigan stands exceptional in terms of the excellence of our leadership and the diversity that you mentioned. It's also one of the reasons why we get some interesting tweets about that. But I will say that I am one of those women from Michigan and proud to say so. So we'd like to be able to get a few questions. Christine, do we have any?
We do. So this came right in as we got going today. And it is, how much of the state's budget goes to police?
So I probably should have had that at hand before coming here. I don't actually know the answer. I don't know the answer to that question. I will tell you that, you know, a lot of this conversation, you know, has been looked at the city level or the county level, where you see these numbers where policing and public safety is like the second or third highest budget item. That is not the case at the state level by any stretch of the imagination. The Michigan State Police budget is nowhere close to that as far as level. But I think what the question becomes, again, and I alluded to this earlier, is the question of resources. What are the investments that we actually need to make to create an experience of safety for people, and really the investment we need to make to create an experience of safety for Black folks and community of color and communities that are fighting persistent poverty, that have not been invested in, and that have not had the experience of feeling like law enforcement is actually on their team or on their side. And so again, when I talked about the investments that we've made in education access, when I talk about the investments that we have proposed in early childhood education, the investments that we've made in healthcare access and expansion, the investments that we've made in skills training and higher education attainment and professional development attainment, these are the investments that we believe help create the conditions to to create a path to success, create a path to feeling safety, and then deal with those social determinants of health that have been created such of a challenge in the context of the pandemic.
Thank you so much. That's all the questions that we have.
And thank you so much for making that point about social determinants of health. Indeed, really, we're talking about the economic determinants of health. And so pleased that you've talked about the investments, that we should put our money where our mouth is. And we know that's an uphill struggle because the executive is just one of the components of our government. I do have a follow-up question that I'm happy to share with you, but I want to share some good news with you. So as a result of being a part of the really wonderful array of seasoned people that are part of the task force, as we looked in the PCP, or the primary care work group, I immediately became excited when we started having conversations about community navigators, because we know that when people have been affected by coronavirus, their lives are turned upside down. Well, who's helping them and helping their families to get the resources that they might need? We also know there hasn't been enough of a public health investment, that we have enough people to help with contact tracing. So Lieutenant Governor, we want to let you know that 5 of us that are part of the coalition are going to step up to participate in this new model and donate time to train our parents to be supportive, not only relevant to the health information that may be needed, but so importantly, the resources, because we want to put some love on them and support.
Yeah, that's fantastic. I appreciate that. And I think what that speaks to is, you know, we all have a role to play.
Yes.
We all have things that we can do. God has given us all tools, our minds, our hearts, our hands, our dollars. We all have things that we can do, and we must. It is our obligation, I believe, to do what we can. And so, what I would encourage everyone to do, and I don't know, I don't think I need to convince anybody on this call necessarily of this, but I think it is.
But we have a wide listening audience. Please advocate away.
Well, nevertheless, but to arm ourselves as we have communication with other people in our life is about, like, in addition to calling on others to act, we must also charge ourselves with action. And so all of those things are not only possible, but necessary in order for us to achieve the scale of reform that we need and demand. And so I appreciate that as an example, you modeling that for finding a way for yourself and other leaders to get engaged. And we all have things that we can do from our respective vantage points, and we need to fully embrace our potential in that regard.
Okay, one last item before you leave, and so many people may not know the breadth of your background. Certainly when you talked about being an organizer, and I actually saw you in action in 2008 in the Obama campaign. I'm also, and all of us are the beneficiaries from your technology background and how you use that to inform and look at how we must address the digital divide. And so one of the things that we've been talking about with our task force is the recognition that we can't talk about having remote or online health support if people don't have access to the internet. So many of us are standing with you and are now saying, can we work together to create an internet for all approach that we bring together people that are in the education arena, and we have several organizations that have stepped up, and bring together folks in health and social services so that we can make sure that every household has access to information, knowledge, and resources, because COVID has clearly ripped the veil off of the lack of our internet infrastructure and devices and equity.
Yeah. I cannot overstate how important that is to me. Look, the first research project I did as a freshman in college was looking at the divide in internet access on the east side of Detroit, and like why that is, and like literally I went like door to door doing a public survey about, you know, what people would do if they had it, how much they would pay for it, all that kind of stuff. Like, this is something near and dear to my heart. I remember my first job was building computers with this guy in Southfield, and the first ones I installed were at Butzel on the west side. And the 5 computers that I made, and I taught this class, and I remember showing this little girl named April the internet for the first time. And, you know, this is 98, just to give y'all a sense of how old I am, about 16. And we were showing her, we were using Alta Vista search engine for those of you who remember that. And we searched for tigers, and she saw the Detroit Tigers logo and a Bengal tiger from India. And like when she recognized that tiger was not at the zoo, that it was on the other side of the world, I just saw just her imagination just explode. Like, wait a minute, I can access it. And like every person, every child needs to have that experience available to them. And so this is the most I think important and the best infrastructure investment that we can make is by connecting our people. And so this has been something that I've been focused on very heavily and very intently during my tenure here, in the concept of COVID-19, ensuring that we could have kids in the city and across the state having access to the internet and internet-enabled devices. And we're going to continue to push that forward. And I love how Jametta, you and others in the task force are focusing on how we can use that to improve health outcomes, because it certainly is a tool that should be used in this regard. And so I'm going to continue to fight for that. And Michigan can be the state that connects our people, and is a model for the rest of the country on that. And I'm excited to continue to work toward that. And we have a unique opportunity to do so right now.
So Lieutenant Governor, thank you. The coalition is all about how do we connect each other, find our power, and make change that's effective for our entire community, and certainly the state of Michigan. I want to just check one more time. Have we had any questions, additional questions come in, Christine?
We have not. Thanks, Jametta. And just to remind folks, we do want to hear from you. So you can put your questions or comments in the chat, and you can also text them to 313-288-2082. Thanks, Jametta.
Thank you. And thank you, Lieutenant Governor. It's a joy having you at our COVID-313 town hall. And to all of us in the listening audience, there is a reminder for all of us. All of us can step up for social action. All of us are needed because COVID is still here and may come back even stronger, which means that we have to be more focused and be stronger as well. Thank you so much, Lieutenant Governor. Be blessed.
Thank you, everybody. Y'all take care and be safe.
Thank you. So we're going to make a transition, but very consistent in our theme. So we've heard from Professor Enrique, where he laid out for us very clearly the nature of racism, structural denominant, the way that the demographics work and play out with racism is very clear. And to continue this conversation from a public health framework, we're very excited always to bring back Crystal Hepburn, who is the lead for special healthcare needs at the Detroit Health Department. Crystal, welcome back.
Hi, good afternoon. Thank you so much for having me back. And it was a pleasure following Lieutenant Governor Gilchrist. Again, the social determinants of health and the racial disparities are quite evident in our area. I do want to go ahead and recognize, of course, our current numbers in Detroit. I think we've been doing a great job. We've seen some huge dramatic decreases in the number of cases. In Detroit alone, it's 11,280, and the deaths related to COVID is 1,409. We're doing a fabulous job. We do want to go ahead and stress to continue to maintain the safety measures. Make sure that you are using your hand hygiene, wearing a mask properly fitted over your nose and your mouth, and maintain your social distancing. Those three key factors, in addition to your constant cleaning and making sure that you are being very aware of your area and making sure that you are not passing it on. So moving on, not only do we have those great numbers, but we do have at the Detroit Health Department a number of new features on our website. The new features especially are related to the reopening. Individuals will be able to go ahead and find services available through the Detroit Playbook. At the Detroit Playbook, you will find information that many of our restaurants, our facilities, such as daycare agencies, etc., are taking to make sure that your health is at the utmost regard, making sure that the employees are all safe and providing you and your children or your partners the best possible care while visiting their environment. In addition to that, there is a need for additional personal protective equipment. If there is a request, please feel free to email dhdoutbreak@detroitmi.gov. The Detroit Health Department is continuing to monitor many of those vulnerable individuals, those especially living in shelters, nursing homes, and senior facilities. Again, some of the features on the DetroitMeansBusiness.org website will offer strategies and operations, finance and accounting support. Individuals should also look at these particular policies and guidance to ensure that they're familiar when they are re-engaging with the community, perhaps participating in any of the peaceful protests or the marches, that they are taking their health into the concern. New website features at the michigan.gov/coronavirus will also indicate the state of risk that we're currently at. Currently in the Detroit area, you can see that we are now in the medium risk, which has been a significant change, which has allowed us to go ahead and continue with the reopening of many of the services. However, testing is still available. Testing will be available for all residents in Detroit at the state fairgrounds. Prescriptions are not required. The phone number is 313-230-0505. Transportation is available, as well as the services are available in multiple languages. With the reopening, there's been many items that have been put in the executive order, allowing as of June 1st, indoor social gatherings of 10 individuals inside a facility are now allowed as long as social distancing is provided. Outdoor social gatherings are also up to 100 people, maintaining their social distancing. Furthermore, many of our retailers were able to open June 4th. Many of our restaurants, food courts, and different establishments have been allowed to open as of June 8th. As mentioned, please check the guidance to ensure that the facility that you're looking at has been approved. Some businesses are not currently approved, such as tattoo parlors, nail salons, etc., like that. If you happen to have any questions or concerns, you are always welcome to call the Detroit Health Department. Your health is at the paramount of what we do as a community service. We want to make sure that we are providing services and care to each and every individual. We are advocating for additional public health dollars. We're making sure that individuals have access to care. We do have our immunization clinics and a few others for services. Thank you very much for your time today.
And Crystal, thank you. Just want to check, perchance, is the Lieutenant Governor still on the Zoom call with us? We've had another question to come in, but we will make sure that that question reaches his office. If not, then I'd like to pause for a moment. If there are any questions for Crystal and the Detroit Health Department, again, you can text it to 313-288-2082 or put it in the Facebook chat. Christine, do we have any questions for our Detroit Health Department?
Hi, Crystal. It's great to see you this week again. Could you just share for all of us, should we still be wearing masks when we go out and those kinds of things? Could you just tell us what some of the protocols we should be using still to keep ourselves safe?
Yes.
Healthy.
So to keep yourself, So to continue to keep yourself healthy and safe, you do want to continue to wear your mask, making sure that it's fitted properly, covering your nose and your mouth. Anytime you're leaving your home, especially if you're participating in some of the wonderful protests that we've had to go ahead and make change, we do see that there quite large numbers. We want to make sure that everyone is being safe, and we don't want to see a reinsurgence of the COVID coming back. We've done a great job here, but continue to please wear them anytime you're using some facilities, such as grocery stores, different types of restaurants. They have requirements in which you'll now need to be wearing a face mask. It is up to the businesses and business owners. They can now deny access to their particular establishment if the individual refuses to comply with that request. It is the safest thing to do. We don't want to see a huge insurgence. I know Arizona and many other areas, after they've done the reopening, have had larger numbers than they did at the original outbreak. So we're trying to go ahead and monitor it. Just today, it was noted that we have seen a huge increase in those individuals in the age category of 20 and slightly above. It could be due to reopening, re-engaging with friends. Again, please try to go ahead and make sure that your face is covered to avoid any type of transmission. Again, this particular virus is spread through coughing, droplets when speaking, sneezing, different things like that. So that's the number one thing. Secondly is the social distancing. There's less risk when you're in smaller numbers, smaller groups, and have less access to get those droplets to you.
Thank you so much. And I just want to remind folks to keep posting your questions and comments in the chat. We should be posting in the chat right now a survey for you to fill out, and you'll be entered into a raffle for $25. Thank you so much, Crystal. Amanda?
Thank you very much.
Yes, and thank you, Christine. And thank you, Crystal, for reminding people that the states who have begun to open up as a result of people not staying focused on social distancing and wearing their masks, we're seeing upticks. We absolutely do not want that to occur in Detroit or Michigan, in fact, anywhere. COVID is still here. But we want to move again in our agenda for you today, and we're going to focus on childcare. You've heard the discussion about essential workers. Well, what information do you need if you're having to continue to work? And we're pleased to have Oriana Powell from Mothering Justice to speak to us about that. Oriana, welcome.
Thank you so much, Jametta. Can you hear me?
Yes, we can, and we can see you too.
Okay, great. Excellent. Thank you. I want to thank you so much for doing this. I'm so happy to be a part of this coalition. I feel like over the last few months, this coalition and its town halls have really been a resource to the community. It's been really great, a great place to direct people to, a great place to find answers to questions that you didn't even know you wondered about. So it's been really helpful. So I just want to thank you all, everyone who's partnership here. Thank you for all the hard work that you all have been doing. Again, as Jametta said, my name is Oriana Powell. I'm the childcare movement organizer at Mothering Justice. Mothering Justice, I'm sure was talked about before, but we are focused on issues deeply related to economic injustice when it comes to Black women, Black caregivers, Black mothers. So one of the issues that we were focused on prior to COVID-19 and really for the last few years we've been advocating for is the need for affordable, accessible, quality childcare. That's in Detroit, that's in Michigan, in our rural areas everywhere. And we know that because of systemic issues like racial and even gender issues, we know that the work of the childcare provider has completely been divested from, has completely been devalued historically, coming from a place of slavery and immigrant folks coming into America to be caregivers and to care for our children. So we know that it's already a place that has not been highly invested in. We know that with new administration, a lot of those issues that we know as parents or providers or anyone in relationship with children, we know that that issue is huge for us, but we now finally have an administration that will actually see the value in this work as well. So we've been advocating and supporting any of the administration and any of the local efforts to bring affordable, accessible childcare to Detroit families and to Michigan families alike. So we know that providers were already really struggling with this issue. And so the time down was definitely a struggle for a lot of folks. I think Michigan did do a pretty good job with doing its best to connect providers to support, to resources for folks who were caring for essential workers' children. There was definitely some emergency things put in place that really did support people being able to continue to work because they were essential workers, and continue to support folks who still had to move around. But we know that because this system and this sector is already highly underinvested in, that the issue really needed to be addressed from the beginning. How we would how would we allow centers to keep their doors open? How would we address the needs of families when folks were home, and now that we're reopening, going back to work. Reopen means that workers go back to work, and a lot of workers are parents, are caregivers, are folks who are caring for children, and workers are childcare providers. So we want to make sure that we're able to do that as safely as possible, and with as much dignity as possible. We know that speaking about I know soon we'll be talking more about what it looks like to defund the police. And I think childcare is really one of those sectors that we really want to look into bringing more investment to, and really helping others to see the importance and the value there is in the folks who take care of our young. So for us, the things that we're focused on and that we're advocating for absolutely has everything to do with funding. I think no matter what the personal choice or the personal preferences for parents of how care is provided, we can't do that without money. Child care centers have a lot of different and new restrictions on themselves so that we can keep children safe, keep providers safe, and it's going to take money to do that. So we actually had an interview with a child care provider last night who really was able originally, because that's her full-time job, and she also was actually working a second job, which was in food, but had to close down. She really struggled initially when she had to close down because she couldn't afford to keep her center open for childcare for essential workers. And I think part of the issue was that there's not enough funding. After all these months, I think she was able to get unemployment, which took a while. And then we know that the bills that were created, the CARES Act gave $3.5 billion to, it was an investment in childcare. But I've seen recent reports as to numbers that look like we really would need to be able to take care of what childcare needs and to reopen all our states. We would need something like $10 billion a month. So $3.5 billion is just not enough. Right now, there's a childcare essential bill, childcare is essential bill, and that looks like it's asking for an investment of $50 billion, so that we could really get folks back into place, whether that looks like I need a family member now, whether that looks like I would rather my child stay home, or we're going back to home care, different homes or facilities. To make all those changes, to get the personal protective equipment we need more money. So we want to just make sure that folks know that the Child Care is Essential Bill and the HEROES Act is another thing that has some investment, but we need more significant investment. And so we're really wanting to educate folks around to consider this issue and to really think about what it will look like to push and press on some of our officials to really make sure that money comes down, because that's really the only way Michigan is going to be able to afford to do so. We highly, like many states, we definitely depend on the federal money, and so that money is really only going to come so that people can take care of kids if we get that money here from federal things like the Child Care is Essential Act and the HEROES Act.
Oriana, thank you. And thank you for lifting up that there are 2 active legislative opportunities, and that childcare, quality childcare, is essential for not only families, but it's essential for our economy to move forward. So the role of early childhood and helping pregnant families and families that have young children all the way into those first several years of school is a critical time period, and one that we have to invest in. And while we're continuing to talk about childcare, we're pleased to have join us Goya Diaz, who is from the Detroit Hispanic Development Corporation. Goya, welcome.
Good afternoon. My name is Goya Diaz, and I am the Director of the Family Department at Detroit Hispanic Development Corporation. I am a mother of 5 lovely children and a grandmother of 9 lovely grandbabies. Yes. I have lived and worked in Southwest Detroit for the past 22 years. Today, I'm going to talk to you about informal childcare provider and what we have done working with informal childcare providers. Okay, so first of all, What is a child care provider? This is a person that provides care to a child outside of a licensed child care setting. It's a family member like a grandparent, an aunt, a cousin, be a brother, a sister, sister-in-law, or your comadre. You know, it also could be a friend or even your neighbors. So what are some reasons why we hire informal childcare providers? It's a person that you trust and of course that you know. It's also a safe place for your children to be at. And it's definitely more affordable than what you would do, than what you will pay at a childcare center. As many of you know, here in Southwest Detroit, there is no childcare centers. So we are left to rely on grandparents, friends, people that we know, right? At DHGC, we have provided informal childcare providers bilingual, which is English and Spanish workshops on child development, healthy eatings, and have provided them with educational materials. Since March, we have kept in contact via phone calls with informal childcare providers. Many of them are currently not working at this time. We support them by providing them with resources and referrals. Our job is still definitely not done. DHGC's vision is to empower, educate, and promote personal wealth. Our next steps, we will be doing a virtual meeting on preparing to opening up, guidelines, precautions, and providing additional resources as needed. Topics would include resources on how to disinfect your house properly according to the CDC, safety in the home, first aid, CPR. If you or anyone you know and live in Detroit and are interested in participating, you can email me at gdiaz@dhgc1.org or call me at Detroit Hispanic Development Corporation at 313-967-4880, extension 2018. Thank you so much for your time and thank you for having me.
And thank you, Goya, and thank you for lifting up that the Detroit Hispanic Development Corporation and other agencies are here to provide support for the informal but absolutely critical kindred and community care that families need to go back to work. We'd like at this point to hear from Ashanti Bryant from Hope Starts Here, IFF. Welcome, Ashanti, and if you would, 5 minutes, please.
Yes, good afternoon. Chandra, you can start us off. Chandra Marshall from Hope Starts Here. Yeah.
All right. Thank you so much. My name is Chandra Marshall, and I'm the Implementation Policy and Research Manager at Hope Starts Here. There are resources that are available for licensed care providers in response to COVID-19 and to ensure that our providers, children, and families are safe as we re-engage. So the LARA guidance was issued May 21st, and Hope Starts Here in partnership with the Policy Equity Group under the leadership of Jeff Capizano, along with other partners, have developed a Build a Plan tool, and Mr. Bryant will explain more about the tool in particular as IFF is offering technical assistance as support. As an update, all child care providers must develop and implement a COVID-19 preparedness and response plan consistent with the LARA guidelines. This tool serves as a resource to do just that. Overall, please know that resources are available at DetroitEarlyLearning.org. Mr. Bryant?
Thank you. And I just want to briefly, thank you, Jametta, for this platform. 5 minutes to talk about how we support providers, right, with serving families and our youngest citizens. Difficult to squeeze it in, but we're going to do our very best. I do appreciate Oriana framing what the issues are in the city. Then our colleague Goya, just sharing the work that's been done on the southwest side. So in partnership with Hope Starts Here, IFF has worked to develop a tool that can be accessed by early childhood providers as we are, again, beginning to phase back in, hopefully safely, into providing care for children throughout the city. This tool is designed to meet the state's guidelines follow really leading practices. We can't really say best practices because I think we're all still learning what some of the best practices are. And then frankly, recommendations to just limit the spread of the virus and make decisions that are right, not only for the children, but for the staff and families, and frankly, feasible within the facilities that providers are operating. To date, some of the technical assistance calls and conversations with providers, you've heard this already from our previous colleagues, are around ongoing support and understanding how to access the ongoing supply of personal protective equipment, recommendations around sanitation procedures, et cetera. And then further assistance to providers in specifically understanding and just at a granular level, what are some direct recommendations that are aligned with the LARA guidance for reopening and or continuing the childcare programs in the city. Concerns are being raised about staffing levels, parent concerns generally about reopening, what is the appropriate levels of space for young children. The need for additional investment is absolutely pressing as providers are thinking about potentially being able to add additional hand washing stations and or breaking children out into spaces, and additional staffing needs to be able to meet the ratios, but also to effectively supervise and care for children. So the challenge is big, but we do have a tool that we developed in partnership with Hope Starts Here. You can actually access this Build a Safe Plan tool by going to DetroitEarlyLearning.org or going to the Hope Starts Here Detroit.org website. Thank you.
And thank you. You commented that it'd be difficult to get in. You got it in. Thank you so much. And so we had a look again for our services to pregnant families and children to age 8. We want to talk about what's going on right now in our schools. And so we're pleased to have join us Earl Phelan, who is with the Phelan Academy. Please join us.
Thank you so much. Great to be here today and great to hear our other panelists. Just a quick overview of Phelan Leadership Academy, is named after my mother and father. We're a nonprofit network, started 7 years ago. We have 22 schools in our network that serve about 10,000 scholars in 5 states. One of those schools right there in Detroit. And in trying to turn around schools, we're blessed to turn 7 schools already from being F-rated schools into the high quality A-rated schools that our children deserve. When this crisis hit, like many others, we kind of had 3 immediate reactions. One was we have to make sure that the nutritional needs of our scholars and our families get met. The second one was how do we make sure that the academic growth of our students continues. And then third, and unfortunately probably this one should have been second, but third was how do we take care of the social emotional needs of our scholars. This has been such a hard time for children, obviously, with George Floyd's murder, with COVID, with loss as it relates to the disproportionality of COVID deaths, and just of the protests. And our scholars have so much that they want to express. My prayer is that when we go back in the fall, that everybody isn't, hey, get your books open because you had this learning gap, but rather is to listen to our scholars and to take care of their social emotional needs, because it's been a difficult journey. Our teachers, like many, rose to the challenge and would call families twice a week, and we started to create clubs, and so that was a good piece. When I think about the reopening safely, it's interesting with the other panelists, I didn't really realize until 2 weeks ago how school is so viewed by so many as childcare. And obviously it's a place of learning, obviously it's a place of social emotional growth, et cetera. But I was very concerned about how quickly we're working to reopen and how unbelievable and undoable some of the requests are as it relates to social distancing with children. Buses that had 3 to a seat are now supposed to have 12 on a yellow bus total. One-way hallways, half time in the school, half time being taught virtually. There's some pretty complicated dynamics as we're being encouraged to come back to school. We were so concerned about what this impact, because most of our children are Black and Latino, and most of our children are low income. We were so concerned about the disproportionate effect of this. Obviously, we worry about our scholars. We also worry, as other speakers have said, about the health of our families and of our scholars' families. And so we created a 172-step guide. I wish I knew about the IFF piece, but we created a 172-step guide of what we think is going to be required to reopen safely. And when you look at some of the things, temperature checks, masks, one-way hallways, not utilizing media centers, choral areas, gyms, and other things, bus transportation, additional cleaning staff, additional supplies for scholars. When you start going down the list of what you would really need to do to execute this well, and that's just the operational side, that's not even the teaching of the children who are virtual and teaching of the children who are at school. When you see what it's cost, we think it's going to be about $100,000 to $150,000 per school to actually uphold the guidelines that we're recommending. We've been very blessed when this crisis happened to get a lot of donations, to be creative with our title funds, and make sure that every one of our scholars now has older scholars have Chromebooks, younger scholars have iPads. Every home now has access to technology, and we have a help desk that's open 12 hours a day with multiple languages to help our families with any technological issues they have, or any issues they have when we're doing our virtual summer learning program right now for our scholars. I guess my hope and my prayer as we reopen is that, let me step back. In some of our districts, they're saying they're not going to help with the testing of staff or scholars, and obviously there's a health system to do that. They're saying that's the health system's piece. That's concerning to us. In some, they're saying they're not going to do temperature checks because the temperature checks have 20% false positives or what have you. I would just push everybody to make sure that as we drive to reopen, which seems to be driven by the economy, that we actually put our children's safety, our children's family safety, and the incredible teachers that commit to and staff that commit to our children, I hope we put them first. Thank you.
We all share that same sentiment, that our children should come first. Health and safety should come first. I want to open up right now. You shared a great deal of information and also the plan that you're implementing, both in terms of technology support, but also being thoughtful about what does it really look like at the point that we go back into the buildings. Christine, do we have any questions for the Phelan Leadership Academy?
We do not, but we do have a reopening related question for Crystal. But we want to encourage folks to put their questions in the chat or text it to us. Crystal, do you mind popping on for just a question really quickly here? Thank you.
I'm here. Can you hear me?
We can hear you.
Okay,
so
perfect.
You had mentioned in another call that the city would be providing guidance for churches. Is that document posted yet? If not, when will it be available?
So the information was just going through its final phase. It was supposed to be released last Friday. I did check again on Monday. I checked twice today. I don't have it yet. I was told I was going to get it. As soon as we do get it, I know that there's a huge list. The city is going to send out a list to all the faith-based organizations. Kim Pandy has also gone ahead and been responsible for a lot of the Department of Neighborhood meetings, along with Ray Solomon, and they have contact information. And lastly, our environmental health. With the new guidelines, it might have been delayed with different inspections and things like that. If any individuals are interested in reaching out to somebody, our environmental health department has gone ahead and provided a number of inspectors or a number of individuals that could provide guidance. I know I've talked to 2 different religious organizations today, both in Detroit, of course, and they will be able to go ahead and schedule a walkthrough or a Zoom conference call. So if anybody has any requests, if they'd like to, they're welcome to send the information to me or it can go directly through to the environmental health department, and we'll try to go ahead and have something scheduled in the interim while we're waiting for the guidance to come down.
Thank you, Crystal. That's very helpful. And we now do have a question for Mr. Phelan, if he could come back on. Thank you, Crystal. This question is, how can we expect students to stay safe when they go back to school? Which I know is very open-ended, but if you could share some of your thoughts about how we can expect that.
I think it's very difficult. I mean, when you start at the point of transportation, as I shared, there aren't enough buses in America to bus if we're expecting 6 feet of social distance, 12 children to a bus. We usually have about 40, 45 on a bus. And so you can't afford it and there aren't enough buses or bus drivers. But assuming that the bus company does a good job screening their staff and testing their staff, that masks are worn by bus drivers, that we're able to, as a nonprofit, secure enough resources to make sure all of our scholars have masks, and the younger scholars, we want them to have visors as well. We are going to be in a hybrid model, I believe, where 50% of our students are in school. Group A is in school for a week, and Group B is at home, getting learning delivered virtually, and then vice versa. So there is an opportunity to have, we're getting guidance 10 to 12 scholars per class, desks 6 feet apart, plexiglass in front of our teachers' desks. I mean, if you're in education, you love children, and so it's hard to think that you're not going to be able to give a high five or a hug or a pat on the back to the scholar that needs it. But if we want to keep everybody healthy, we're going to have to try that social distancing piece. I think it's going to be incredibly challenging to keep everybody safe, but we've tried to line up at least a process that gives us the best chance of staying safe as possible. We believe all scholars, teachers, vendors should be tested, and we believe that we are going to have to limit the amount of visitors. We have a lot of guest speakers who come in and do great things with our kids, and partnership groups. We think that's going to have to be limited to keep our scholars safe. So I'm being long-winded, but it's going to be a challenge, to be honest with you. And we're just trying to be as safe as we possibly can while servicing our children.
You've talked a lot about many different ways to keep your scholars safe, and I think many educational institutions are thinking the same way that you're thinking. Could you expand a little bit on what kind of extra cleaning you might be thinking about doing, and if you all are planning on providing masks?
Yeah, so we're purchasing it now, because what we found with the PPE, with all the sanitizers and everything we're getting is lined up to CDC guidelines, and we're moving on it now, because when we went to purchase the computers, that was early March, and we said, all right, we can have our kids on devices and what have you by April. It really took 3 months, 2.5 months to get to that place, because everybody else was making the same move. So I'd caution groups not to wait till the last second, or not to wait till our governors give us advice about how to do it, because you may not get your protective gear and your other hand sanitizers and your other CDC recommended cleaning supplies. You may not get that till late September, October, which is obviously far too late. So we're using funds, both philanthropic and others, to help purchase the supply and the volume that we'll need. We had to increase our janitorial staff by basically 1.5 kind of more FTEs per campus, so that we could take care of the safety. Every one of our classrooms has outside it a kit of extra masks, of Lysol, of hand sanitizer, et cetera, et cetera. We shut off all water fountains, because babies like to put their mouths on the water fountains when they're drinking. So we had to shut off all water fountains as a precaution, and we're ordering water bottles for scholars. We're advising our scholars that ever since the beginning of school, children like to swap and share. Hey, I'm going to give you my apple for your bag of potato chips, or what have you. You can't do that anymore. Lunches will be delivered, but you can't share anything with anybody else at this point. So we're just trying to do as much of the common sense stuff, understanding that it's going to be a challenge. Scholars want to give one another a hug when they see them. They want to give their teacher a high five or a hug when they see them. It's going to be a challenge, but we're going to try.
Thank you so much for all of that really good information. I just want to make a note. Crystal from the health department wanted us all to know that if individuals would like to request masks for their peaceful protest, you can email dhdOutbreak@detroitmi.gov in advance to request supplies to ensure that everyone is safe. So if you need masks for the protest, please reach out to the health department. Thank you all so much. Keep the questions and comments coming in the Facebook chat or via text, and there should be a survey in the chat right now. If you fill it out, you'll be entered into a raffle for a $25 gift card. Thanks.
Sounds like a winner. So not only do we need people to complete the survey, we need people to complete the census, because the census is one of those critical mechanisms to ensure that our community not only has the appropriate representation in DC, but that we gain the resources, the funds to precisely help with these issues. I do have just one quick follow-up question to Mr. Phelan. So you've identified and actually come up with a budget for these additional costs. For all schools, both charter and DPSCD, are there additional dollars that are being made available to you through COVID from the CARES Act or any other federal funds? If Mr. Phelan is still with us, then we'll make sure that we get that question. That is one of the things that parents have been wondering about, but also that this is our opportunity for social justice and action. We need to make sure that our schools and our child care centers have the resources to keep all of us safe. And speaking of safety, and how do you feel in navigating these very challenging times? Of course, we need to talk about our social and emotional development and how we're coping. And to help us in this segment to talk about social emotional development and mental health, we're pleased to have join us Michelle Madison. Michelle.
Hi, everyone. How are you?
Welcome.
Welcome. Thank you so much. Well, first, I'd like to introduce myself. Like she said, my name is Michelle Madison. I am a Detroit native. I am also a proud graduate of DPS, a social worker trained out of the University of Michigan, and a yoga instructor. Some of my passions include empowering people to be their best self and also monitor and take care of their mental and emotional health. So there are three things that I'd like to discuss today, very specific to the topics that are discussed in this town hall. One is the idea of tension. So when we feel tension in the body, tension that has no place to go becomes pain. And we're talking about very crucial and important issues within the Black community, the Black and the Brown community, actually. And we're talking about the systemic oppression that has happened to us for decades, and centuries at a time with no place to go. So when you see us in the rallies, when you see us in the protests, when you see us advocating for our voices to be heard, it's because our pain has no place to go. So as we talk about the social and emotional approaches to how we monitor our own health in this fight for freedom, in this fight for, I'm gonna say equity actually, instead of equality, we need to also tune in to the things that arise within us and take control of our own ability to release that ourselves. So the second thing I also want to talk about is grief, the concept of grief and the phases that we are going through, not just from a physical death, but the idea and this sense of loss, especially during our COVID period. So grief is something that manifests very differently for every person. There are some people that really need to, for example, a shortcut example is going to be some people need to cry, some people need silence, some people need to be isolated, other people need to be around other people. And in the midst of a pandemic, when we have to implement certain measures such as social distancing and things of that nature, it becomes very difficult for us as communal people and us as people who enjoy the narrative process of our journeys. It's very difficult for us to integrate in the way that we're used to. So being creative and finding new ways and new innovative, maybe access through technology to call on a loved one, to call on someone that you haven't spoken to in a while, to reconnect in some capacity. Those things are going to be very crucial and important for us to heal during this time. And then the third thing that I wanted to cover is this idea of personal commitment. So as we're talking about racial justice and the approach for it, I want to talk about the first part of that, which is your daily capacity as for someone who may identify as an ally, and also for people who are in the struggle and at the bottom of the oppression that we're talking about here with these systemic issues. Checking in with your daily capacity on a daily basis. That daily word is very specific and very intentional. So if you wake up in the morning and you notice that you do not have enough energy to, I'm not going to say entertain, but engage with a lot of the rhetoric, a lot of the conversations, a lot of the issues that are happening right now for people who are in the struggle, take a step back. Monitor your breathing, monitor what is happening within your body, because that first point that I made with tension with no place to go becomes pain. I'm going to say that again. Tension with no place to go becomes pain. So as we are in this struggle to fight for our advocacy, monitor the tension that exists within your body, because it will manifest into things that are more harmful. And then the second part, for the daily capacity of people who are identifying themselves as ally, I would like you to understand that allyship, this is also a phrase coming out of the University of Michigan from a student organization there. Allyship is a verb. So if you identify yourself as an ally, it is not something that you can call as a title and not act upon it. It is a verb. You have to put your heels in the ground and understand what is within your daily capacity to daily act as an ally to the Black and Brown community who are fighting for rights that have been long deserved, long overlooked, as we've discussed on this call. Giving the time constraint, I don't want to take up too much time, but I did want to just leave it at that. So thank you for having me in the space.
And thank you, Michelle. I'd like to pause for a moment.
Yeah.
And make sure that our audience, if they have some questions,
Sure.
to respond to the powerful statements that you've made, short but powerful. Remember, you can put your information in the Facebook chat, or you can text to 313-288-2082. Christine, do we have any questions at this point?
Not at this time, but thank you for that amazing information. It was really helpful. Thank you.
Of course, absolutely. Thank you.
Yes, and thank you. So one of the things we've been talking about is the pain that people have. And we have all been pained seeing what happened to brothers and sisters who have been brutalized by the police over and over again. We even heard our Lieutenant Governor speak to his own experiences, and everyone in our communities can testify to the same thing as well as my own experiences. What we'd like to do now is have a conversation. We're hearing a lot about defund the police. What does that mean? And to begin to help us unbundle that conversation, we're very pleased to have Helen Foster, and she's with the Black Youth Project 100 and Mothering Justice. Welcome, Helen.
Hi, thank you so much. So yeah, like you said, I am currently Justice. I'm also an inactive member since 2016, I believe. So yeah, I want to talk to you guys about defunding police and hopefully one day abolishing them. Defunding the police and abolishing the police is something that I think brings a lot of fear to people because that is what we know as safety right now, right? But in reality, community investments are what keep us safe. If people have their basic needs met, if people are able to access quality jobs, access food, access education, access mental health care, all these things that more wealthy communities already have access to and aren't over-policed, we are able to protect ourselves and don't need the over-policing that's present. Rashida Tlaib just posted a graphic about a week ago, I think, that showed Detroit's city budget for 2019. And the Detroit Police Department had a $300 million budget. And to me, that's ridiculous, especially when you see the graph and see how small all the other bars in that graph are compared to that gigantic police budget. I can think of about 300 million things to do with those $300 million. Like I said, I think that community resources are the key. Mental health services, which we know have been defunded for years and years. Education, which has also been defunded for years and years. All these things have been put off to police to make them basically social workers with guns. These are social issues and need to be addressed socially. and not violently with terrorism.
Thank you. It's a simple equation, right? When people's needs are addressed, the need for police literally disappears. And there's certainly over-policing and not a look at transformative processes with the community. Christine, do we have questions for Helen?
Helen, could you share a little bit more about what it might look like if you were to defund the police? What would we see instead of that? Like, what would that look like?
So I think that that's the beauty of police abolition and defunding the police, is that we're building a world we've never seen before. These are things that our communities get to decide and figure out what our communities need that will keep us safe. One thing that I've heard and I think is a beautiful thing is instead of calling like 911 for someone in your neighborhood who may be having a mental health crisis, being able to call a different number where a mental health expert is able to come out, de-escalate that situation, make a plan for that person, find somewhere safe, and the whole situation is solved. And we've seen in situations like that, people have been killed when it could have been as simple as finding them the mental health support that they need.
Great, thank you so much. Jametta?
And that reinforces the other reason that we're here for our community. And that is to provide those telephone numbers, those hotlines. So we would encourage you. The Detroit Wayne Integrated Health Authority has a hotline. Many of the partners that have been on our program, Children's Center, Development Centers, have hotlines because they have that expertise to respond. The other question, perhaps, Helen, if you could answer quickly, is the term community policing. What does that mean?
It's kind of hard to define. It's basically, my definition of it is creating a police force within the community allows those connections, right? So we talk about needing to have police officers that are from the city so that they have those connections to people in the city. And I think, in my opinion, it's kind of the same concept, but on a smaller scale. You know your neighbors, you know what neighbors may have a drug addiction problem or may have mental health issues, and you're able, because you know those people, you are able to help them in ways that respect their humanity and give them fill their material needs.
Thank you. So we're going to keep our eyes out, and we can learn a lot from the community in Minneapolis that has called for defunding. We know that there are other communities all across this country that are transforming themselves, even working with those progressives in the health department, as well as the police, to see how can we create a better nurturing and safety net for all people in our community. As we talk about safety nets, we have to talk about our families, and we have to talk about our parents and our children. And to help us as we get ready to move into the very end of our program with you today, we're so delighted to have Hope Starts Here to return again, and to have Tamara Grice be our speaker. Tamara is a community coordinator with Hope Starts Here. Welcome.
Jametta,
yeah.
I don't want to lose this question. I'm sorry, and it just
go ahead. No worries.
I feel like we're on a little bit of a delay. So I apologize for that. So Tamara, could you just, one moment. Michelle, are you still on? I don't think she is. Okay.
Hi, I'm still
there
here.
she is.
Oh,
She's with us.
Hi.
Okay.
Hi. Yeah. So do you have suggestions for ways to check in with Black youth and parents? I work that I work with as a white social worker. I want to check in without making people uncomfortable, so looking for some ideas.
Got you. Well, I think that we have to start with understanding what that person's relationship is with their students. If they have a naturally close relationship prior to these issues, I think that going off of the strength of that relationship to begin with is already an avenue to check in. For example, if there isn't a pre-existing close relationship with the teacher and their students, finding subtle ways that don't directly imply that you're only checking on them out of the convenience of what's happening. So creating genuine and authentic connections is very crucial and important. I think that we as people in general are able to, I think the healthiest way to put this is kind of peep when people are reaching out to us for very specific reasons and just out of the general cause of our mental health. So making sure that the approach is authentic, genuine, and coming from a place that is sourced from goodness and not attached to what is happening specifically around the area, because the things that are happening are not new. Specifically to us, we've seen it for years and years at a time. So though it may be new and something fresh to other people, it's not new and fresh to us. So making sure that when you try to establish that relationship with someone and check on the betterment and the well-being of them, you're doing it out of the authenticity that you care for them, not just based off of what is going on around us. Though those things are important, it may come up. Don't let that be the initial reason in the initial preface of what you include in it, because it's not new to us.
Thank you, Michelle, so much.
Yeah, of course.
Jametta, back to you, and thank you for letting me interrupt, Jametta.
No, absolutely. That's how we roll. But I just want to say that we're Michelle, your point is so well taken, because we now see that there are tens of thousands, not hundreds of thousands of more people who better understand racial disparities, things that we've been talking about for decades, and in fact have had solutions for. The joy of this is that there are more people ready to act and move forward on the things that we know work. It's awesome. Thank you so much again. So we'll transition back to Tamara with Hope Starts Here. Tamara, we need to hear your voice and your power as a parent and a community coordinator.
Hello, everyone, and hi, parents out here. I first want to say thank you for being who you are. My name is Tamara Graves. I'm a mother of a 16-year-old, a 12-year-old, a 5 and 2-year-old. I'm also a caregiver for my parent. I'm directly aligned with several organizations, state and local, but I'm a Detroit champion for Hope. I serve in districts 1 and 7, and I am a community outreach specialist. And so I wear a lot of hats, but the hat that I enjoy the most is being a mama, okay? And I think that, you know, we're all homeschooling right now, and I wanted to give you guys some tips on what I do in my home. So there's 6 things a day that I encourage my children as one of them. I encourage them to be who they are. I allow them to learn through doing things, because I feel that the classroom is the environment, the natural environment, your home. Anywhere that you and your child are is a learning environment. So if they want to bang on pots and make music, if they want to create art, I allow them to express themselves in that way. I also I talk all the time, maybe a little too much. I talk to my kids often. We talk about things that they want to learn about. We do research, we use YouTube, we use everything at our disposal to keep open dialogue, even with the little ones. We read, and not just storybooks. We read stop signs, we read stuff when we go to the grocery store. We look at things in our home that may look like letters or shaped like certain things. And that's the way I keep, you know, literacy rich in my home. And play. So I am very competitive. I love games. With my older kids, I've introduced dominoes and spades and things of things of that nature. With the little ones, we do house, we study life skills. And that's just basically being a mom and they're watching me. And hugging. I know you're probably thinking, what can you learn from a hug? Well, guess what? Your children will have a sense of safeness and being together with you. Those hugs, they create so many endorphins in your body of that happy place, and that they're learning that they are protected just by a hug. And then, last but not least, we sing. We sing all the time, and why I love singing is because music allows both your right and your left brain to work simultaneously. And it's one of the few things that can do that. You can teach so much through song. And so I encourage you all to visit Hope Starts Here Detroit on Twitter and Facebook. Our website, hopestartsheredetroit.org. And you can also personally reach out to me if you want some resources, you want to talk. I do so many things in the community and I miss you guys. So I'm at championforhope@gmail.com. Thank you.
And Tamara, I'm one of those people that's been blessed to watch you talk and nurture your children. So everyone, please check out the Hope Starts Here website for your 6 a day of how to make your child feel loved, special, and powerful. Christine.
Thank you, Jametta. We are at 1:55 exactly, and it's time to wrap up our town hall. We want to thank all of our panelists that joined us today, and we want to thank each of you for joining us today. If your question wasn't answered, we'll get the answers for you and post them next week on onedetroitpbs.org and on the DPTV Facebook page. Again, we'll be here every Thursday from 12 to 2 with the most up-to-date information related to COVID, but also just related to things that matter the most for our children and our families and our community. You can sign up for regular updates by filling out the form that's in the chat right now. Put your email or phone number. You can also text that information to us at 313-288-2082. Again, that number is 313-288-2082. And it's become tradition to give you guys a couple of asks before we go. The first is there is still time to fill out the census, and it's really important that we are all counted. It should take about 10 minutes for a person to fill it out, but these 10 minutes will ensure that we have the funds for education, healthcare, food, and emergency services for the next 10 years. And we heard today how important those funds are, particularly in this time and in this moment as we are trying to ensure that our children are safe when they go back to school, so that they can be in front of teachers and learn. So please make sure that you fill out the census. You can encourage your friends and family by participating in our Sidewalk Chalk Challenge, #WeAllCount. Second, please continue to do your work to fight racism every day and show up to support the Black Lives Now and ongoing. This is our work. We must do this if we are going to dismantle racist systems. And it is a long journey. We've been fighting this for a long time. Communities have been fighting this a long time. Without us, it is important that we continue to fight, and we fight with our Black community ongoing. Before you go, we also want we want to know more about what you'd like to hear about in our town halls. So if there are other topics or experts that you want to hear from, please share them in the chat now or text us at 313-288-2082. We're posting the survey one last time in the chat. Please fill it out. You'll be entered to win a $25 gift card in a raffle. And as I say every week, this town hall is truly a group effort. So before we go, could everyone please turn on their cameras? All of our partners, please turn on your videos. And we want to remind everybody to stay healthy, stay powerful, and stay strong. Cindy, can you please translate that into Spanish? Or Christina.
Que todos se mantengan con salud, fuertes y apoyándose unos a los otros.
Thank you. And Saeed, can you translate that into Arabic?
حافظ على صحتك، كن ثابتا ومتينا وابقى قويا. إلى اللقاء. Thank you.
Thank you all so much for joining us. Thank you to our panelists again. Everybody have a really great day.
Have a great day. Everyone be blessed.